the discussion enlarged into all kinds of substance abuse, other drugs, and alcohol, because so often an individual taking one drug is also taking other drugs as well. He asked that I attempt to do a study of how New York City, New York State, and the federal government deal with heroin, with the crime that heroin causes, and that I do a study of alcoholism and alcohol abuse and the death and destruction that alcoholism brings to our people here in New York State. The governor's objective is for us to prepare a model program ranging from law enforcement to prevention that could be used in New York State, that would help define the relationship between New York State and the federal government and city government and the private sector, and that might someday be followed not only here but around the country. To that end, we held hearings in Buffalo last week. This is the first of several hearings we will hold in New York City and Long Island. Today's hearing is on heroin. To give you a sense of how critical this problem is, a federal study which was just completed took a random sample of 237 heroin addicts and traced their history over an 11-year period. It concluded that those heroin addicts committed at least 500,000 crimes to support their habit over that period. New York State has about 237,000 heroin addicts, 10 times that much. That would mean that on average, if one could calculate the crimes those addicts committed, that heroin addicts, that 237,000 heroin addicts, will commit 5 million crimes in New York State over the next decade, most of them here in New York City, just to support their habit. So I think you can get a sense of why Governor Carey is so concerned about this problem and so concerned about what it can do to this city and this state. We will not deal with alcoholism today, except insofar as there are relationships in terms of abuse and addiction. But I would note just one simple fact about alcoholism that the governor and I talked about Saturday on the telephone. Alcohol, through drunken driving, is the largest single killer of Americans under 34 years of age. Last year, 28,000 Americans under 34 years of age died in drunken driving accidents. So I think you can see why the governor's also concerned about alcohol abuse. Governor Carey will be here.
Martinez, who is the chairman of our Toxic Substance Abuse, director of our Toxic Substance Abuse Division in New York State. And just a note to relate to when I first teamed up with Julio, he was in Forgotten City, a strip of land along the Hudson River up near Albany, our state capital, and he came to me when we were in dire financial straits, when we had little money, in 1976, and asked for help for drug-free programs. And I was so impressed with him then that I followed him, traced him, and he now heads up our division. He's out of the streets. He's one who's known among those who are addicts and potential addicts as one who can help them. And I feel that in your continuing effort to help on this problem, as you know, he can be of major assistance to you.
Well, Mr. Martinez is going to testify later today.
But during our discussion, I hope we can use him occasionally to bring in the facts and data that will, I think, help us in terms of approaching this problem on a sound basis. Coming from 1976 up to 1980, You're aware that last September in Bryant Park, in the center of Manhattan, I sounded an alarm against the spreading danger of heroin addiction in this state and across the nation and many parts of the world. And 6 months later, we are still in the midst of a heroin crisis. Heroin from abroad continues to pour across our borders, bringing with it a wave of violence and misery and death. Last year in New York State, 630 young people died from heroin overdoses, and another 1,300 were treated in hospital emergency rooms. There was a 30% increase in the number of persons entering drug treatment programs, and now, with these programs filled to capacity, there are 1,200 addicts and abusers waiting for treatment that we know of. An unknown number of our young people, both in the suburbs as well as in the inner city, have begun experimenting with drugs that are readily available on any number of street corners. Yet, since that September day, New York State has committed more than $4 million for increased treatment and law enforcement services in the battle against addiction. To deter the growing use of drugs among school-age children, we have invested, Mr. Chairman, nearly $15 million for prevention services in our schools and communities. In my executive budget, currently before the state legislature, I am calling for an additional $9 million for the expansion of drug treatment services over last year's level. We are channeling law enforcement assistance aid and other funds to bolster our efforts at controlling the spread of heroin in our streets. In addition to expanding and intensifying treatment services, we've set up a Citizens Alliance to combat heroin, the acronym is CATCH, to develop a coordinated and concentrated effort against the current heroin epidemic, made up of concerned citizens, community leaders from throughout our state. CATCH has recently submitted to me its assessment of the state's heroin problem and its recommendations for implementing a plan of action. And the committee which I am now addressing, so ably chaired by you, Mr. Califano, will shape our future strategy by reviewing the heroin and alcohol problem in the state and developing new programs that involve both the public and the private sectors. Yet whatever actions we take as an individual state will ultimately be ineffective unless there is an equal federal commitment to closing our borders against heroin and marshaling our resources to treat and rehabilitate addicts. Unfortunately, just the opposite is happening. The Reagan administration is seeking short-sighted outs that will have grave consequences over the long run. In the face of the present crisis, and in the face of a mounting toll of lives, the administration in Washington has called for elimination of the National Institute on Drug Abuse's formula grant program. They have called for 25% reduction in the federal share of treatment and prevention money, a cap on Medicaid, elimination of CETA, and cuts in education and food stamp funding. If implemented, these cuts would turn out 2,300 drug-free treatment clients and another 2,300 patients from methadone programs. 1,200 abusers waiting for available treatment will be sent back to the streets and crime and further addiction. Those 5,800 individuals and the thousands more who will seek help will be left to return to welfare or swell our already overcrowded jails, correctional institutions, and criminal justice system. It is, I'm afraid, Mr. Chairman, a clear case of sowing the wind and reaping the whirlwind. To treat a substance abuser in a program costs $2,268 per year. It costs several times that amount. It costs several times that amount to support a person on welfare and Medicaid. If that addict or abuser hustles on the streets or becomes involved in crime to support a drug habit, police, judicial, and prison costs will reach $19,135 per year. Therefore, Mr. Chairman, to cut off a program which costs $2,268 and invite participation in a system that will cost us $19,135 speaks for itself. It is simply not wise policy. Neither this state nor this country can afford the social and economic cost that will result from an ever-growing number of untreated addicts, and even less can we afford the needless waste of young lives that will result. The administration in Washington has spoken, of course, about reducing government costs while still addressing the needs of what they call the truly needy. But who is more needy than a 14-year-old child whose entire life is a constant hustle for the next fix? Who is more needy than the young man or woman caught in a nightmare of addiction and violence, condemned to a short and brutal life on the streets of the ghetto, or for that matter, among the streets and walks of a suburb? By any standard, these people are part of the truly needy, and yet they're being read out of the federal budget. Mr. Chairman, your home state, your native state, New York, has made its commitment. Through a coalition that spans every segment of our society, through increased enforcement and treatment, through our schools and private institutions, we are putting all our resources into the war against heroin. We ask the federal government to join us in creating a new beginning for the thousands trapped in lives of addiction, and the millions, in one form or another, must bear the consequences.